Hello there, welcome to Dr. Sushant's anatomy tutorial. In this video, I'm going to talk about the posterior compartment of the arm. Now, the posterior compartment of the arm contains principally only one muscle, and the muscle that's present in the posterior compartment is the triceps brachii muscle. So, what do you mean by triceps brachii muscle? It's a muscle that has got three heads of origin, just like the biceps brachii, which has got two heads of origin. So we know that the biceps brachii muscle lies in the anterior compartment. So in the previous video, we discussed the anterior compartment of the arm, and I also gave you an introduction to the compartments in the arm, out of which there are two compartments, out of which we discussed the anterior compartment already. So we are now left with the posterior compartment, which I will cover in this video. So like I was telling you, there's just one muscle in the posterior compartment, that's the triceps brachii muscle. And then we have the nerve that is supplying the triceps brachii, that is the radial nerve. And going with the radial nerve is the largest branch of the brachial artery, the profunda brachii artery, right? And we also have a part of the ulnar nerve after it pierces the medial intermuscular septum. So part of ulnar nerve. So these are the basic contents of the posterior compartment of the arm. First, let us talk about the muscle in the posterior compartment, that's the triceps brachii muscle. So as the name indicates, the muscle takes its origin by three heads. So it has got three heads of origin. What are the three heads? So it has got a long head, it has got a medial head, and a lateral head. So these are the three heads of origin of the triceps brachii muscle. So basically this muscle monopolizes the posterior compartment of the arm. Now coming to the origins of these three heads of triceps brachii muscle. First, let us discuss the long head of the triceps. The long head of the triceps brachii muscle arises from the infraglenoid tubercle of the scapula. So this origin, the long head, arises from the infraglenoid tubercle of the scapula. And remember, this origin is actually extracapsular, unlike the long head of biceps brachii, which is intracapsular. The origin of long head of biceps brachii is extracapsular. Now this head, the long head, after it takes origin from the infraglenoid tubercle, it passes downwards between the teres major, which lies inferiorly, and the teres minor muscle, which lies superiorly. All right. Now we'll look at this muscle here. So this is the posterior aspect of the cadaver. All right. So in the posterior compartment, we are going to look at the muscles here. So the muscle here is just one muscle. This is the same deep fascia that encloses the arm, which is called the brachial fascia. And we see these cutaneous nerves here. This cutaneous nerve is the posterior cutaneous nerve of the arm. Now let me hide the deep fascia, the brachial fascia. So now I see the muscle, the triceps brachii muscle. So this is the triceps brachii muscle, the only muscle in the posterior compartment of the arm. Now let's talk about its attachments. It has got three heads of origin, isn't it? So the long head of the triceps brachii muscle arises from the infraglenoid tubercle. That's a bony projection that's present inferior to the glenoid cavity of the scapula. So this head arising from the infraglenoid tubercle is the long head, and then we have the medial and the lateral heads of the triceps brachii. So we all know that the posterior aspect of the shaft of the humerus presents a spiral groove that is directed downwards and laterally. Now the medial head of the triceps brachii muscle arises from the posterior surface of the shaft of the humerus below the spiral groove. Right, and the lateral head of the triceps brachii muscle arises from the posterior surface of the shaft of the humerus above the spiral groove. Right, so that's the origin of the medial and the lateral heads of the triceps brachii muscle. Right, so the lateral head from an oblique ridge that is along the lateral lip of the spiral groove, and it actually lies behind the deltoid tuberosity. All right, and the medial head arises by fleshy fibers from the entire posterior surface of the humerus below the spiral groove, and it also takes its origin from both medial and lateral intermuscular septa. And for those of you who do not know about the spiral groove, so this spiral groove is present on the posterior aspect of the shaft of the humerus. So I recommend you go back to my video on the osteology of the shaft of the humerus, where I have shown the spiral groove. So I can actually show you the spiral. I don't mind showing you again. So here is the shaft of the humerus. All right, so now I'm trying to draw the posterior aspects, so medial condyle, the trochlea, the capitulum, and the lateral condyle. Now since it is posterior, I have to draw this olecranon fossa on the posterior aspect. Now we know that this is medial, this is lateral. Now almost at the middle of the posterior surface. Okay, so this is the medial border. Here is the lateral border. Okay, now running downwards and laterally along the posterior surface is the spiral groove. So it is actually a faint groove like this. Okay, that's running downwards and laterally. So you have to imagine it as a sulcus, as a groove. Okay, so it's a shallow area on the posterior surface. You will not be able to appreciate it very easily. You have to carefully look for this spiral groove on the posterior surface of the shaft of the humerus. Now running in the for the spiral groove are the radial nerve here, accompanied by the profunda brachii vessel. So we will see the profunda brachii artery and the profunda brachii vein. So these structures run in the spiral groove. So these structures are actually coming from the axilla, isn't it? Now here we have the lateral intermuscular septum, isn't it? So this is the lateral intermuscular septum, and along this line we have the medial intermuscular septum, and we know that the lateral intermuscular septum is pierced by the radial nerve, okay, somewhere here, or maybe little downwards. So let me erase it. So somewhere here, okay, the lateral intermuscular septum is pierced by the radial nerve and also a branch of the profunda brachii artery. So here is the profunda brachii artery. It gives you an anterior descending branch, okay, or the radial collateral artery. So these structures actually pierce. Okay, where do they pierce? This is the posterior aspect of the lateral the shaft, the entire shaft of the humerus basically. So the radial nerve, after piercing the lateral intermuscular septum, it goes to the front along with this radial collateral. So the radial collateral artery will anastomose with the radial recurrent artery on the anterior aspect of the lateral epicondyle of the humerus. So here we have the radial nerve and the anterior descending branch of the radial collateral artery. So now you have an idea, right, of the spiral groove. Now when we discuss the origin of the medial and the lateral heads of triceps brachii muscle, so the long head arises from the infraglenoid tubercle. So let me draw the glenoid cavity. So is the glenoid cavity of the scapula, and this is the border, lateral border. So here is the infraglenoid tubercle. So that is exactly where you have the origin of the long head of the triceps brachii muscle. Okay, and this triceps brachii muscle passes between the teres minor and the teres major muscles. Okay, we know the teres major muscle arises from the upper 2/3 of the lateral border, and from the lower 1/3 we have the origin of the teres major muscle. So these muscles will pass in this direction for insertion. Okay, so the long head passes between the teres minor and above and the teres major below. Now the spiral groove, so let me erase these dots. Okay, so that's the direction showing the insertion of the teres major and minor muscles. Now above the spiral groove we have the origin of the lateral head of the triceps brachii muscle. Well, let me draw. Yeah, so from here we have the origin of the lateral head. As you can see, above and lateral to the spiral groove we have the origin of the lateral head. Below and medially we have the origin of the medial head. So medial head also takes its origin partly from the medial and lateral intermuscular septum. Right, so this is the origin of the triceps brachii. Right, so here we have above and laterally the lateral head of a triceps brachii muscle. Below and medially, that is below and medial to the spiral groove, we have the medial head of the triceps brachii muscle, and from the supraglenoid tubercle is the long head of the triceps brachii muscle. So that's about the origin of the triceps brachii muscle. Now where is the insertion? So the insertion of the triceps brachii muscle is on the superior surface of the olecranon process of the ulna. Okay, so here is the radius and the ulna. Okay, so insertion of the triceps brachii muscle is to the middle of the posterior surface of the olecranon process of the ulna. So this is where the insertion comes. So at the insertion, the triceps brachii presents aponeurosis. Okay, so it is an aponeurotic insertion. So I believe the 3D atlas is better than my diagram. So look at this. So we have the three heads of the triceps brachii joining together to form the a massive belly, a muscle belly, and then in the lower part it forms the tendon. So the long head and the lateral heads together and the medial head. So these three heads joining, forming the aponeurotic insertion, and then this is going to get inserted to the middle of the posterior surface of the olecranon process of the ulna. So that's the insertion of the triceps brachii. So what happens in insertion? The long head and the lateral heads, they converge to form a flat tendon first, as you can see in this picture. Okay, separate tendons are seen here. The lateral head and the long head, L and L together form a flattened tendon that lies superficial to the medial head. Right, the one that lies deep is the medial head. So both together insert into the posterior part. Okay, it insert to the posterior part of the superior surface of the olecranon process, not the middle part, the posterior part. Anterior to the insertion there is the bursa. Alright, so that's the insertion of the triceps brachii muscle. Alright, right. So what is the nerve supply of the muscle? So the triceps brachii muscle is supplied by the radial nerve. Okay, the radial nerve. So in the axilla, the radial nerve gives a muscular tweak to the long head. In the spiral groove, the radial nerve gives branch to the long head, again, the medial head and the lateral heads. So basically, it is the radial nerve which is going to provide innervation to the triceps brachii muscle. Now, let us look at the action of the triceps brachii muscle. As you can see, it crosses the elbow joint, right, and it is inserted to the posterior aspect of the elbow joint. So when the muscle contracts, it extends the elbow joint. So the action of triceps brachii is extension of the elbow joint, and also the long head of the triceps brachii, it supports the humeral head in abducted shoulder joint. Right, so extension of the elbow, and also keeps the head of the humerus in position during abduction of the shoulder. So this is about the muscle triceps brachii muscle. Right, now let us look at the structures passing between the heads of triceps brachii muscle. Structures passing between the heads. Okay, so now between the long and medial heads, long head and medial head, we have the radial nerve. Okay, as the radial nerve enters the spiral groove from the lower triangular space, it passes between the long head and the medial heads. Okay, along with the radial nerve there is the profunda brachii artery. Profunda brachii artery also runs along with the radial nerve. Now between the lateral and the medial heads, okay, between the lateral head and the medial head, again we have the same structures, radial nerve and the profunda brachii. Vessels would be better term because we also have artery and vein. So profunda brachii, vessels. Okay, so what happens is the radial nerve from the axilla enters the lower triangular space, and then it passes between the long head and the medial head. Long head and the medial head. Then it enters the spiral groove. In the spiral groove, it lies between the lateral head and the medial head, along with the profunda brachii vessels. Okay, now between the lateral head and the long head, there is another structure. Between the lateral head and the long head, we have an ascending branch of the arteria profunda brachii. What is it? An ascending branch of profunda brachii artery. Okay, so this artery is going to anastomose with a descending branch of posterior circumflex humeral artery, humeral artery, which is a branch of the axillary artery, the third part of the axillary artery. So an anastomosis can be seen between the lateral head and the long head of the triceps brachii muscle. All right, so this is about the triceps brachii muscle. So what else do we have in the posterior compartment? We have this important nerve in the posterior compartment, the radial nerve, right? So before reaching the spiral groove, the posterior, which is on the posterior surface of the humerus, the radial nerve along with the arteria profunda brachia, that's the profunda brachial artery, it traverses at first the lower triangular space. I believe you know the boundaries of the lower triangular space. If you do not remember, the boundaries of the lower triangular space are: above is the teres major, right? And then medially we have the long head of the triceps brachii muscle, and laterally we have the shaft of the humerus. So from the axilla, the radial nerve straight enters into the lower triangular space. Okay, and thereafter both the nerve and the vessels, which vessels? The profunda brachii vessels, they enter the spiral groove right between the long head and the medial heads of the triceps brachii, and then it runs downwards and laterally, as you can see in this picture, right? So this picture is very clear. So then the radial nerve runs downwards and laterally, right, between the medial head and the lateral heads of the triceps brachii muscle, okay, along with the profunda brachii vessel. Okay, in the lower part of the groove, they are separated from the bone by origin of a part of brachialis muscle. Okay, so the origin of the brachialis muscle embraces on the posterior surface. Slightly, it takes a twist in a posteriorward direction. So don't worry about the last point I just mentioned. Okay, so further, the radial nerve along with the radial collateral branch of the profunda brachii, that is the anterior descending branch, right? So these structures appear in the anterior compartment of the arm after piercing the lateral intermuscular septum, as I demonstrated here. So on the lateral side we have the lateral intermuscular septum. So piercing the lateral intermuscular septum, we can see the radial nerve and the anterior descending branch of the profunda brachii, or the radial collateral artery, going to the anterior compartment of the arm. And the radial nerve passes further down, and it comes to lie in front of the lateral epicondyle. So this is where we have the lateral epicondyle. So the radial nerve reaches the front of the lateral epicondyle. I'm representing this in dotted lines because we are looking at the posterior aspect of the arm, and the radial nerve is on the anterior aspect. So the radial nerve is in front of the lateral epicondyle. In front of the lateral epicondyle, the radial nerve divides into two branches. That is the superficial branch of radial nerve, and the deep branch of the radial nerve. The deep branch of radial nerve is called the posterior interosseous nerve, and it supplies the deep extensor muscles and some of the superficial extensor muscles of the forearm. The superficial branch of the radial nerve is a cutaneous nerve. It supplies the 3.5 digits of the dorsum of the hand. So we will talk about this terminal branch of the radial nerve later, but at this point of time, just remember that the radial nerve terminates by dividing into a superficial and a deep branch in front of the lateral epicondyle after piercing the lateral intramuscular septum. All right, so that's the story of the radial. Now let us look at the branches of the radial nerve. Okay, so it is very important to know the branches of the radial nerve in the arm. Right. So in the spiral groove, the radial nerve provides three sets of branches. So in the spiral groove, please remember that the radial nerve lies between the medial head and the lateral heads of the triceps brachii muscle. Now, if there is any fracture of the shaft of the humerus in the middle, okay, if the middle of shaft of the humerus, it can result in the damage of the radial nerve. Because the radial nerve supplies the extensor muscles, all the extensors are going to be paralyzed, and the wrist is going to drop, and the condition is called the wrist drop. Okay, so injury of the radial nerve gives rise to what is called wrist drop. Wrist is dropped, so you cannot extend your wrist because extensor muscles are paralyzed because the radial nerve is injured, and the radial nerve supplies the extensor muscles. Therefore, this is called the wrist drop. Okay. Now, speaking of the branches, so three sets of branches it gives in the spiral groove. Okay, three sets of branches. What are they? So it gives you muscular branches. This is to supply the muscle, none other than the triceps brachii muscle, and it has the articular branches. Articular branches to supply the joints. Okay, and also it gives you cutaneous branches, okay, to supply the skin. Now, what are the muscular branches of the radial muscular branches of the radial nerve? So the muscular branches of the radial nerve in the spiral groove supply the lateral and the medial heads of triceps brachii muscle. So what about the long head? The branch to the long head arises from the radial nerve while it is in the axilla. Right, so I'm discussing the branches of the radial nerve in the spiral groove. Because it is in the spiral groove, the muscular branches are given only to the medial and the lateral heads. Please remember, the muscular branch, the long head, arises while the radial nerve is in the axilla, not while it is in the spiral groove. Okay, so it is above the level of the spiral groove. Now these branches, that is to the medial head and lateral heads of the triceps brachii muscle, is given off as the nerve passes between the two heads of the muscles, okay, within the substance of the muscle. Now this branch to the medial head, okay, this branch to the medial head of the triceps brachii. So branch of radial nerve in the axilla to the medial head, okay, it passes through the substance, it actually descends through the substance of the muscle, and it supplies another muscle. Okay, it supplies, that is, branch to medial head passes through the substance of the muscle and it supplies another muscle, anconeus. Anconeus. So this anconeus muscle is a superficial extensor of the forearm. In addition to this, it also gives an articular branch to the elbow joint. So articular branch to elbow joint. Okay, so name the muscular branches of radial nerve in this spiral groove. The muscular branches of radial nerve in this spiral groove are going to supply the lateral head and the medial head of the triceps brachii. Among this, the branch to the medial head of the triceps brachii, it passes through the substance of the muscle and it provides a muscular branch to the anconeus as well as an articular branch to the elbow joint. Right. So the long head is supplied by the branch of the radial nerve while it is in the axilla. Okay, so the medial head receives innervation from the radial nerve while it is in the spiral groove. In the axilla also, the medial head of the triceps receives a branch from the radial nerve. So long head while in the axilla, medial head once while in the axilla, and for the second time while in the spiral groove. So the medial head of the triceps brachii receives nerve supply twice, once in the axilla, second time while in the radial groove. Okay, not the radial groove or the spiral groove, both correct. Okay, so radial groove or spiral groove. Now, which are the cutaneous branches arising from the radial nerve? Cutaneous branches while it is in the spiral groove. So it gives you the lower lateral cutaneous nerve of arm. Okay, so this nerve actually pierces the lateral head of triceps, and then it supplies the skin of the lateral part of lower half of the arm. Okay, so what does it do? It supplies the skin of the lower half of lateral aspect. Okay, the lateral aspect of arm. So that is why it is called lower lateral cutaneous nerve of arm. So where is the upper lateral cutaneous nerve of arm? The upper lateral cutaneous nerve of arm is given by the axillary nerve. Okay, so the upper lateral cutaneous nerve is a branch of the axillary nerve that comes from the same cord, that is the posterior cord. So this axillary nerve supplies shoulder joint, it supplies the deltoid muscle, right, and it also supplies the teres minor muscle. Right, that's one of the cutaneous branches. There is another cutaneous branch, that's the posterior cutaneous nerve of forearm. Okay, forearm, posterior cutaneous nerve of forearm. So this branch is also arising from the radial nerve while the nerve is in the spiral groove. Okay, so that's about the branches of the radial nerve in the spiral groove. So it gives muscular branches to the three heads of the triceps brachii muscle. It gives you articular branch to the elbow joint, and it gives you cutaneous branch, lower lateral cutaneous nerve of the arm, and the posterior cutaneous nerve of the forearm. Another important structure in the posterior compartment of the arm is the arteria profunda brachii. Arteria profunda brachii. That is nothing but the profunda brachii artery. Okay, so it's a fairly large branch. In fact, it is the largest branch of the brachial artery, and it appears in the spiral groove accompanied by the radial nerve. Now, what are the branches of the arteria profunda brachii artery? So, in the spiral groove, okay, the branches in the spiral groove. So this reference is important, spiral groove. So one of the branches is the muscular branches. So these muscular branches of the profunda brachii is going to supply the adjacent muscles. Then it sometimes gives you the nutrient artery, right? So this nutrient artery is going to supply the humerus. Okay, so usually the nutrient artery arises from the brachial artery. If it does not arise from the brachial artery, it will be given off by the profunda brachii artery. Then it gives you an ascending branch. Okay, so there is an ascending branch of the profunda brachii artery. This is also known as the deltoid branch. Okay, the deltoid branch, and it passes between the lateral and the long heads of the triceps muscle. Okay, and then it anastomosis with the descending branch of the posterior circumflex humeral artery. So this ascending branch of profunda brachii anastomosis with the descending branch. Okay, descending branch of posterior circumflex humeral artery. So this ascending branch is a branch of the profunda brachii. So these two arteries anastomose here. All right, and the another branch is the middle collateral branch. Middle collateral branch. So this middle collateral branch descends through the medial head of the triceps brachii. All right, and this anastomosis behind the lateral epicondyle. Okay, anastomosis behind the lateral epicondyle. So this anastomosis I am referring to is the anastomosis around the elbow joint. Okay, it is anastomosis between the branches of the brachial artery, profunda brachial artery, the radial artery, common interosseous artery, and the ulnar artery. So all these arteries are anastomosed with each other in the region of elbow joint. So that's the anastomosis around the elbow joint. So one of the arteries contributing to anastomosis around the elbow joint is given off by the profunda brachial artery, and this artery is called middle collateral artery. Okay, there is another artery which contributes to the anastomosis around the elbow joint coming from the same artery, and this artery is called the radial collateral artery, or this is also known as the anterior descending branch. All right, so this artery, you know about this artery. So this radial collateral branch, it pierces the lateral intermuscular septum, right, along with the radial nerve. Okay, and yeah, so these are the branches of the, well, profunda brachii artery. All right, so we have come to the end of the posterior compartment of arm and the arm, actually speaking, because in the previous video we covered the anterior compartment of the arm. In this video I covered the posterior compartment of the arm. So basically the arm is complete. Thank you very much.